At Progressive Therapy Associates, we treat individuals with stroke, and something to keep in mind there is you don't have to be elderly to have a stroke.
Yeah, I mean, people in their 20s have strokes as well.
So some of the things that we look at there is, evaluating people to determine, do they have aphasia? Do they have a language component, right? Depending on where their stroke is, whether it's a left or right hemisphere stroke, that will depend on, what their needs are and how we would address their specific treatment.
Maybe we should describe what aphasia is.
Okay.
So essentially that's broken language.
Right.
So what that means is the person might not understand things the same, or they're maybe not able to speak the same. You might see some breakdowns with how they write, how they read. Any area of language can be impacted with aphasia.
Yeah. And something that I think is really important there is the knowing is intact. And it will seem like maybe my loved one doesn't know, or they don't remember, when in fact it's the language piece of it, right? One of the things that I'll tell my patients and families often is, for instance, if we have a blizzard in, Fargo, or out in the country in North Dakota, Minnesota, you still know where the grocery store is. Being able to travel that pathway to get there doesn't look the same, right? So our treatment is helping to make those new connections, do the work you need to make those new connections, plow that so that you can get to the information and that's really how aphasia looks.
Yeah, in other words, the words are still there, but the person's ability to maybe find them in their brain and to be able to say them, that's where it's breaking down.
Right.
So when you're talking about making new connections, that's that neuroplasticity piece.
Right.
What is that connection that we need to rebuild so that the person can find the words to be able to speak more fluently or write more fluently or whatever it might be?
True, wherever it's breaking down, and usually it's breaking down some across all of those areas. So basically, something to think about too is maybe your grandmother or your husband or wife had a stroke many years ago. Or maybe they had a stroke a year ago and had some intensive treatment, but maybe still have some skills that they're really struggling with. Free consultation could help us to determine, okay, what else could we potentially do? What other approach can we take to really make additional gains that impact your day-to-day life?
Yeah, I think sometimes people think, well, that was 10 years ago, what can I do? But you might learn that person really did very little with the rehab piece, or maybe they were discharged home and no therapy happened.
Yeah.
I've worked with people who've had their strokes over 10 years ago, and we're still able to see gains with therapy, even though it's 10 years past onset.
Yeah. And that's where, again, neuroplasticity, right? That ability to learn new things. Yeah. If you've had a stroke, does that mean you can't learn new things? No, it doesn't. No, it doesn't. Our brain is amazing.
Yeah, it is. And we need to stimulate those pathways that are not connected quite the same, though, if we want to see some of those skills look better.
We might need to take a alternative approach, right?
Yeah.
We might need to treat this in a new way, or in a way that you haven't already.
I mean, some people will come to our office and they've never even heard the word aphasia. But that's what's going on here.
Right.
That broken language piece. So even understanding that there's a term for this and it makes sense and there's something that we can do about it, I think that's helpful for people.
Often people think, if I can speak, that there isn't any breakdown. And it's like, well, that's great, because we can have a stroke and be unable to speak as well. But you can certainly have a stroke or neurosurgery or lots of things that happen, or even a traumatic brain injury that results in an aphasia. I know the information, but I can't quite get those words out to tell you. Or I'm using an organization of words that doesn't make sense. Communication is really powerful. We're addressing that routinely with our patients.
I think the education piece for the family is just as helpful, so that they understand, okay, so this is what's going on,
Right.
this is why this is happening. All right, and this makes sense why we're doing this type of homework, because we're addressing that skill that's not going the same.
Well, and communication is a two-way street, right? So if you have an individual who's had a stroke and you have, husband or wife, we want to make sure that they're understanding what they can do to help that communication. Because sometimes family members are very well intended, but they are doing things that make it harder. that they don't mean to at all. They just don't know.
Yeah, exactly. So for example, if the person, let's say they had a stroke and their auditory comprehension skills were not quite the same. Well, there's things that we need to do differently when we're speaking to that person so that increases the likelihood that they'll understand.
Right.
But sometimes people will say this much when really it could be said the same context, but this much. And that makes all the difference with the person being able to understand what's being spoken to them.
You know, and one of the ways that I talk to my patients about that is that auditory comprehension, that understanding. It can sometimes become the Charlie Brown, the want, where someone is hearing verbiage, they're hearing language, but they just stop decoding that.
Yeah, because there's the point where you're just lost and it's not making sense, so you just kind of check out.
Yeah. It becomes almost like a foreign language, right? I know that you're talking to me. I'm not processing what you're saying. Well, you can imagine if that goes unaddressed, breakdown in relationships, breakdown, frustration-wise, pretty soon the amount of work they might give up on trying to communicate needs, wants, and ideas,
Yeah.
even though they're incredibly important.